Good morning. Welcome. We just have a few announcements before we get started. Join us after this session for a fireside chat with Dr. Sasha and Jane on the future of healthcare at today's general session, sponsored via Novalon. And help NHIA celebrate Penny Allen as she receives the 2023 Jean Graves Lifetime Achievement Award. Be sure to make it to the exhibit hall starting at noon. Browse more than 100 home infusion therapy companies, attend an exhibitor theater, grab lunch, and be sure to play Infusion Quest Scavenger Hunt. Take a deep dive into a topic from a variety of perspectives in our 30-30-30 educational session block. Three speakers share a 90-minute session to examine a subject from top to bottom. You will have 45 days to complete the evaluation and claim your CE from the live sessions, but you can earn CE credit on demand for 1 year following the event and enjoy the sessions you couldn't attend while here in DC. The evaluation code to complete the session survey will be provided on the last slide at the end of the session. If you don't need a CE, please take the 1-minute survey to give us your feedback on this session by using the QR code provided at the end of the presentation, or the kiosks just outside the room. During the Q&A portion of the session, to make sure that we are recording, come up to the microphone if you have a question, so that way it can be on the recording. And now introducing our speaker for this session, Alyssa Putman, Organization Development and Training Consultant for Johns Hopkins Community Physicians. More information on any of this year's speakers can be found in the conference app. Thank you.
Thank you. Okay, I'm not using that. Good morning, everybody. So today we're going to talk about navigating post-pandemic stress for you and your team. This is a topic I think that is critical to be talking about. How many of you heard me speak last year on burnout and resiliency? Okay, perfect. And you still came back, that's good. Appreciate it. And then for me to get a sense of who's in the room, this is the leadership track. How many of you are managers? You have people that report to you? Raise your hands up high. Perfect. Okay, so most of you. Perfect. All right, so there's a caveat. I'm on a step because I'm like 5 foot tall. So if I fall, don't be alarmed. I'll get back up. It'll be okay. Okay. So these are the learning objectives for today. We're going to talk a little bit about statistics, about post-pandemic mental health challenges. I'm going to talk a little bit about disengagement, what it looks like, how it affects performance. And then if you notice somebody on your team that's feeling distressed or disengaged, what do you do about it? How do you approach them? Because that is something that we need to start paying attention to as well. So we'll talk a little bit about that. And then I'll talk about strategies to help you and your team remain resilient. So let's first talk about statistics, and these statistics should not be surprising to anybody, to be honest. But what research found was in the first year of the COVID pandemic, prevalence of anxiety and depression increased 25%. Okay, not surprising, right? And at least 41% of US adults experienced high levels of psychological distress at least once since the early stages of the pandemic. Now, I don't know anybody that didn't experience levels of psychological distress. Why that's not 100%, I have no idea. 41%. I think everybody experienced high levels of psychological distress at least one time since the start of the pandemic. What's interesting is that research found that our young adults, ages 18 to 29, actually had higher levels of distress. So this is really interesting when we think about. So this age group is about Generation Z, right? Or Gen Zers, for those of you who are familiar with the generations and the ages. And when I think about it, because I actually have 2 kids that fall in the age range, this really is sort of the first global thing that has really directly affected them, right? I mean, there are like specific examples here and there for other people, but mostly this is the thing that has affected folks in this age group. And my daughter, she's a sophomore at Temple University in Philadelphia. Go Owls. And she told me that just last week, her media professor asked them to write down their top 3 flashbulb memories, right? So he described it as a public event, so it can't be like your cousin's wedding or your bat mitzvah or anything like that, right? A public event that you can remember where you were, how you were feeling, you can remember it, right? So for me, 9/11 comes to mind, right? When I think about my flashbulb memories, right? I think about the Challenger shuttle explosion, dating me a little bit, right? She wrote down for her number one flashbulb memory, March 13th, 2020, when COVID shut down the world. Those were her exact words. So this is her top flashbulb memory when her professor asked her to write it down. So what's important about this for you all as managers, and for all of us really, is that I think a lot of us think about Gen Zers as teenagers. We don't really, unless you have a kid that age, you don't really have to worry about them. But actually, our oldest Gen Zers are in the workforce with us. They're mid-20s. There might be some of you in this room, right? So we need to remember that as managers. So that's why this statistic is pretty important for us when we think about this age group in the workforce. It's so interesting to me, generations in the workplace. It's a whole nother presentation that I do, but it's really interesting to think about how the generations interact with each other, what that means. It's truly fascinating. But I just want you all to think about this as you think about your team and the compilation of your team. Now, not surprisingly, statistics also found that folks that identified as having a disability, physical disability, mental disability, had higher levels of distress. We heard early on that if you had a disability, you were more susceptible to getting sicker from COVID. And then it was also strongly tied to income status. Of course, lots of people were out of work and had a loss of income. But now we have this post-pandemic fear, right? Reinfection, is it going to surge in December, in the wintertime? Socializing, we were just talking about this last night at dinner actually, we're so used to not socializing that now after socializing for a long period of time, we're exhausted when that didn't happen before, right? And people kind of having a little bit of social anxiety. Traffic, I don't know about you all, but my tolerance for traffic has either decreased way down for stupid people on the road, or people have just gotten stupider. I'm not sure. I think it's my tolerance, I really do, because I used to, have to drive an hour each way every day, and then 2 years I didn't have to drive anywhere, and now I'm driving again, and my tolerance has really, really decreased for it. Returning back to school, returning to the office is still a point of contention for a lot of people, so now there's sort of a whole new crop of fears that have come up post-pandemic. So you would think, okay, things are returning back to normal, right, whatever that means. You would think that maybe people seeking treatment for anxiety and depression have decreased, but it has not. It's not rebounded, it's still really high, and in fact, trauma and stressor-related disorders, substance use disorders continue to increase since the pandemic. 2/3 of psychologists reported an increase in symptom severity and seeing more patients since before the pandemic, and an increase in demands from populations of color and young adults. So nothing is rebounding here. Things are continuing to trend upward. 60% of psychologists report having no openings, and if you just try to find a therapist, you will find that. It is hard to find a therapist. There are wait lists everywhere, and it's certainly hard to find a therapist that takes insurance. So things are tough. Now, I do think that COVID kind of shed a light on mental health challenges. I think things became maybe a little more accessible with the advent of online platforms and different ways for people to seek therapy, right? And I think those are still, kind of booming today, but we still need to do way better. So here's a quote from the WHO Director General, and I do tend to read quotes verbatim. I don't usually read slides, but I do read quotes. So, the information we have now about the impact of COVID-19 on the world's mental health is just the tip of the iceberg. This is a wake-up call to all countries to pay more attention to mental health and do a better job of supporting their population's mental health. This really came to light during COVID. So why? What were some contributing factors? Well, certainly social isolation. We know that that led to depression and anxiety. Inability to work, loss of income, I've already mentioned that. Stress and anxiety, obviously, over one's health or one's loved one. Missing lots of special occasions and grieving because of those missed special occasions, but then also grieving over the loss of loved ones or health. Quarantine and mentally unhealthy situations, right? So we had situations where there were folks who were in domestic situations, domestic violence, relationships or families, and now we're telling them they have to stay in their house with these folks for 2 years. So that was obviously very, very challenging. Financial concerns, and then for you all, for healthcare workers, we know trauma, burnout, exhaustion, all of that, right, continues. So employee burnout equals disengagement. We know this, right? So I'm going to talk a little bit about employee engagement. So what is employee engagement? Employee engagement is an emotional connection to the job, right? Feeling connected to the mission and the purpose of the company, the team, and the patients. It's giving discretionary effort. So what the heck does that mean? So I want you all to humor me for a second, and everybody raise their hand in the air. It'll also help you with a little stretch. Now everybody raise their hand even higher. Okay, you can put your hand down. Everybody could do that, right? That's what we mean by discretionary effort. We mean giving a little bit more, giving 150%. That's what we mean by engaged employees. How many of you have heard of the Gallup organization? Okay, about half. So the Gallup organization is a national organization that has spent years and years studying employee engagement. So what they found was that disengagement costs a heck of a lot of money, not surprising, right? But what they also found is that managers' engagement accounts for at least 70% of the variance of employee disengagement. So what does that mean for you as managers? Well, you can't make your team be engaged, right? Like you can't force people to be engaged, but your engagement and your well-being matters to their engagement and their well-being. Employees with disengaged managers are 50% more likely to be disengaged themselves. Think about it. I don't know if you all have ever had a manager who was sort of 1 foot out the door or not really engaged, but it definitely makes a difference. Prior to working for Hopkins, the company I was at, I was there for like 10 years. And one of the reasons I chose to leave is because the manager had started to become disengaged. She stopped advocating for us. She kind of had a foot out the door. And it really does feel like, well, why should I give 150% when my manager's not even advocating for us or giving 150%, right? So the manager's engagement and well-being absolutely matters. So what does disengagement look like? I feel like I could have asked you guys to populate the slide for me. You probably know from your own teams, right? But this is what disengagement looks like. Absenteeism, presenteeism. Anyone heard of that term, presenteeism? Do you know what that term is? A couple of you. So presenteeism is when you're physically there, right? Like your team member's there, they showed up for work, but they're not really doing what they need to be doing, right? They're there, but they're not really all there, if you know what I'm saying. So they're just not doing what they need to be doing. Disruptive behavior, arriving late, leaving early, not going to team meetings or silence during team meetings or being disruptive during team meetings, all of these are signs of disengagement. Patient safety incidents, low patient experience scores, and turnover. We know from research that employee engagement, patient safety, and patient experience are correlated. Those 3 things are correlated. We know that. So let's talk a little bit about engagement, well-being, and retention, right? Because right now, healthcare organizations, they have to be paying attention to retention. It doesn't matter if you're recruiting amazing people and you're training amazing people, because if they're leaving, then you have to recruit all over again, and we all know how much money that ends up costing our organization, right? We have to be focusing on retention. Employee burnout in healthcare, it's a long-standing issue, right? This is nothing new. We've always had staff shortages and decreased resources, budget decreases, escalating workloads, intense patients, right? Burnout is not new, but we know that COVID certainly exacerbated the burnout among healthcare workers. Recent findings show that 52% of nurses and 20% of doctors are planning to leave, which equals increased shortages, right? And we know that when there's increased shortages, morale plummets, access decreases, which causes disruptive patients because they can't get in and they want to get in to see the provider. Providers' engagement, decreases, burnout increases because they have to cover for everybody, right? On and on. It's a cycle. Research also showed that a gap of 3 million low-wage health workers and 1 million nurses were anticipated over the next 3 years. So this is a problem. It is a crisis. Current healthcare challenges right now, retention. How many of you have heard of the Great Resignation? It's been around, that term's been around for like a year or so, certainly within healthcare, kind of referring to droves of people leaving healthcare because of COVID, right? The Great Resignation. So I don't know if any of these sound familiar from your teams to you. You don't have to raise your hand if you don't want to identify, but I've talked to several organizations and this is what we're seeing, right? So we're seeing staff and providers, to be honest, who are misbehaving, for lack of a better word. I don't really know what the right word is, but they're sort of saying, what are they going to do, fire me? If I come 5 minutes late or if I don't do what's being asked of me, they need me more than I need them. There's a huge shortage. They can't afford to lose me. So this is what we're seeing now. across healthcare organizations. And so this pandemic, endemic, or whatever of the Great Resignation is causing bad behavior among our employees. So now, in addition to just having to put out fires, right, having to be a manager and manage and put out everyday fires, our leaders are now needing to be trained in all of these things, right? Conflict management, crucial conversations, combating negativity in the workplace, team building, communicating with empathy and caring, assertiveness, right? And many organizations don't have any kind of structure in place to train our leaders and our managers in these things. So employee well-being, employee engagement, and employee retention are things that we need to be paying attention to as our healthcare organizations. So I don't need to make the business case to you for employee engagement, right? Like Gallup found that all of these things are related to just a slight increase in employee engagement, right? Absenteeism, turnover, all the things that we've already talked about, they're all related. So if you're familiar with the Gallup organization and the Gallup survey, which is a survey that they give out to assess Gallup organization, then these things will look familiar to you. This is called the Q12. So Gallup organization did lots and lots of research, and they found that these are the things that are correlated with high engagement. So if you're like, well, how does somebody be engaged? What are some characteristics? This is what they found. So I know what's expected of me at work. I have the materials and equipment I need to do my job, right? Like if you don't have the glucometers that you need, you're just trying to get through the day. You're not worried about professional development. You're just trying to get through the day. You have to have the materials and equipment you need. We saw this a lot during COVID with people not having proper PPE, right? And the challenges that ensued, that people didn't feel like they could safely do their job because they didn't have the proper PPE. I have the opportunity to do what I do best every day. So if you are meeting regularly with your team members, I would encourage you to do something called a stay interview. Anyone heard of the term stay interview? Yes, a couple of people, right? We always do exit interviews for HR. Why are people leaving? I kind of want to know why people are staying. Don't you want to know why people on your team are staying so you can do more of that, right? That's called a stay interview. You could Google it. There's lots of information on stay interviews. But if you meet regularly with your team members, you should be doing stay interviews. See if they get to do what they do best every day. I'll give you a brief example. So my prior position to this position, I was a director at Johns Hopkins, and we did the Gallup, and this item was a little bit lower on our team. I get to do what I do best every day. So I thought, okay, I want to find out more about that. So I met with all of my clinicians. I was the director of an employee assistance program, so I oversaw like 11 clinicians. So I met with them individually, and I asked them, you know, what is a skill that you have that you feel like could contribute to our department that you are not having the opportunity to use? What's something that you would like to be doing more of, right? That's realistic, like, that can benefit the organization. And so this one employee said, well, I really like to write. Like, I love to write. And, you know, outside of writing patient notes, which nobody likes to do, I would like to write some more. And I said to her, great, like, we're being tasked with starting a blog and creating the content on our website. I can do it. I don't want to. Do you want to do it? She was like, I would love to do it. It was a total win-win because I had the conversation with her about what are your, you know, what skills do you have that you would like to be doing more of that you think would be beneficial to this department? If I hadn't had that conversation, that never would have happened. So having those routine conversations with your team to find out what is it that they want to be doing more of, and is that a possibility in your department or on your team? I received recognition in the last 7 days. 7 days. When managers hear this, they're like, you've got to be kidding me. I have to give recognition every 7 days. That's what Gallup found, every 7 days. And they've done a lot of research, and that was the cutoff for them. My supervisor or someone at work cares about me as a person. Somebody encourages my development. My opinions seem to count. I feel connected to the mission and the purpose of the company. My coworkers are committed to quality work. Q10, the most controversial question across the nation, which is I have a best friend at work, which is Q10, which I always explain to people does not mean that your best friend from childhood works at your organization. That's not what it means, right? It means, do you have somebody that you can talk to when things aren't going well? Do you have somebody that has your back, somebody that you feel aligned to? Gallup found, not surprisingly, that when you have that person, you're more engaged at work. It's not surprising, right? Someone has talked to me about my progress in the last 6 months. I hope that you have something in place where you're doing a mid-year evaluation, end-of-the-year evaluation, so that people are getting feedback of some kind. They need feedback. And I have the opportunity to learn and grow. So what can you do as a leader, kind of based on these 12 questions? I kind of want to play with walking around here. I'm tired of standing on the step. I'd rather be like among you guys and have it feel like a conversation than me talking to you, but then I can't really see the screen. So I'll play with it. Maybe I'll go back on the step. Can everybody see me okay? Okay, hi. Okay, so what can you as a leader do? Praise. Catch people doing things right instead of catching people doing things wrong. Now, what I mean by that is that we've all heard of like the sandwich technique of giving constructive criticism, right? Like you say something nice and then you tell them what you really want to say and then you say something nice, right? We've all heard of that. And I'm not saying that that's not a good thing to do. I think it's a good thing to do, but I will tell you that people do not view that as giving praise. If you're like, oh, you did such a great job answering the phone, however, you need to document a little bit differently, they're not gonna hear you did such a great job answering the phone. They will not view that as praise, right? So it's really important to give praise kind of separately from that constructive criticism, and it's really important to give it very specifically and immediately. So where I work, Johns Hopkins Community Physicians, we are sort of the ambulatory arm, right? So we have outpatient clinics. And so one example that I often give is if you see someone at the front desk dealing with a patient who's disruptive, and they do a really great job of talking to that person, going up to them afterwards and saying, you know what, Jenny, I saw you talking to that patient. That was a really challenging situation. You did such a good job communicating with caring with that patient, right? That is a very specific, direct appreciation and recognition. That person will feel recognized, okay? If you have not heard of the book, The 5 Languages of Appreciation in the Workplace, I encourage you to look at it. I don't get any royalties from mentioning it, but it's a great book. It's based it's kind of piggybacked from the 5 love languages. Has anyone heard of the 5 love languages? Okay, so it's called The 5 Languages of Appreciation in the Workplace, and it takes the 5 love languages and kind of applies it to the workplace outside of physical touch, because apparently physical touch is frowned upon in the workplace, but outside of physical touch, it's the other ones, right? And so I will tell you that when I was a director in my former position, we did a retreat, and we had everybody take the 5 Languages of Appreciation in the Workplace survey. It was really interesting and so enlightening for me to see how people like to be recognized and appreciated, right? Because it's different, kind of like the love languages. Some people like words of affirmation. Cheryl, you do such a great job getting speakers for the education, for NHIA. You're amazing at that. She is, but words of affirmation, right? For some people, it's acts of service. You look really swamped today. What can I do to help you? Okay? For some people, it's quality time. You can talk to me, my door's open, give me a call, give me an email, I'll be there for you, right? So it's really interesting to see on your team how people like to be recognized so that you can recognize them in the way they like. The other thing that was really interesting was public versus private, right? Like some people want to be recognized publicly, like at a team meeting. Let me tell you, so-and-so had the highest quality measures, whatever, right? And they love that. Some people, if you recognize them at a team meeting, they will die. Like they will say, like, please don't ever do that again, right? Kind of important to know on your team who likes public recognition and who likes private recognition. Kind of important. Care. Show your employees you care about them as people. Remember, these are based on those Q12 questions that we just saw from the Gallup survey on the previous slide. So when I talk with so I do training for new managers, and when I talk to them, what I say is, this doesn't mean you need to be up in everybody's business, right? Like you don't need to be asking them all kinds of personal questions to show them that you care about them. Your team will tell you things, right? They'll tell you, oh, I'm caring for my mom, she's sick, or oh my God, my oldest just went to college and I'm a nervous wreck, right? So following up on that, how's your mom doing? I remember you saying that she was sick last weekend. How's she doing, right? Or how are you doing with Jenny off at college right now? It's been a month. Are you okay? How are you doing? That right there shows that you care about your employees, right? They want to know that you care about them beyond just, oh, so what are your numbers? What are your stats? Listen and learn. Remember, my opinions count. People want to feel like their opinions count, especially if you're a new leader or a new manager in your department or organization, and there's legacy employees who have been there for 10 years, They know a thing or two. Listen to them. They know what has worked. They know what hasn't worked. So having those conversations with them is really, really important. They want to share information with you, and they want to know that you as a manager are open to listening. It doesn't mean you need to take everybody's idea or everybody's opinion, but people want to feel like their opinion matters and their opinion counts, right? Clear communication. So I feel kind of strongly about this. I don't think there should ever be any surprises with your employees. There should never be anything written on a mid-year evaluation or an end-of-year evaluation that they did not hear from you before then, right? So I know that it's not realistic for managers, for all managers to have one-on-ones with all their like regular, consistent one-on-ones. They might have a really big team or people are remote, whatever. It is best practices if you can meet regularly with the people that report to you, but I do get that it is not always realistic. But you should at least be having conversations with them before the evaluation to let them know what's going well and what is it that they need to work on. You need to give them a chance to show you they can course correct on the things that you're asking them to, right? Before it's written on any evaluation. So I feel kind of strongly about that one. Support your employees. Ask them how you can help, right? So one thing that we talked about when I talk with new managers in our practices are when you are short-staffed and the phone's ringing off the hook, pick up the phone, go to the front desk, help room patients, right? Just because you're a supervisor or a manager doesn't mean you can't do those things, and it will help you gain respect, utmost respect, if you are working elbow to elbow with your team. Again, different situations, some people are remote, it's not possible, I get that, but asking people how you can help them, how you can support them as their leader. Create a positive atmosphere. So again, this goes back to that engagement statistics, right? That your engagement and your burnout directly affects your team. It's really important. I always use the example when I talk with new managers about, okay, say for example, you need to roll out a new initiative, that the executive team is asking you to roll out. And say that you don't really agree with it. This happens sometimes, right? Like you need to roll out something that you're like, oh, gosh, we're already collecting so many quality measures, this isn't gonna go over well. It makes it different how you present that, right? So if you present it as, all right, they're making us now collect, statistics on such and such. I know we're really busy collecting these other quality measures, but now they're asking us to do this. Well, I guess that's one way you could present it, right? But how is your team gonna feel when you present it that way? They're not gonna feel great about it. They know that you don't feel great about it, as opposed to presenting it in a different way. The other thing that I tell, again, especially new leaders and new managers, when you say they are asking us to do this, you are they. You, managers, are they. So when I talk to new leaders and new managers, by creating this they versus, us versus them situation, that's not gonna work. Because especially if someone's promoted from within, that's probably the hardest situation, to be honest, to be promoted from within. It's very challenging for a variety of reasons. But you are they. So be careful of your language. Accountability. Hold yourself and others accountable. I always say it's kind of like parenting, right? Like follow through with what you say you're going to do. People are watching you. They want to make sure that you're holding people accountable. And then pay attention to how you are feeling and how your team is feeling, right? Because again, your engagement, your burnout is critical to your teams. Coming up to get some water. Okay, so what do you do when you notice someone on your team is not doing really well? So it's important to approach them from a place of caring and concern. Speak to them privately. This can be done in person, it can be done virtually, if you have a remote team, but a lot of people ask me, well, I don't know what to say, and I don't want to offend them, by approaching them. Well, here's an example of what you could say. I wanted to talk with you because I care about you. I've recently been concerned about you. I noticed that you've been arriving late to work or you seem more disengaged, whatever the behavior is that you've noticed. I wanted to check in with you and see how you're doing. Is everything okay? I value you and your contributions to this team. And I also wanted to make sure you were aware of the resources, the free resources that are available to you. I would probably say free confidential resources that are available to you, such as the Employee Assistance Program or other resources. So it is important that that's coming from a place of caring and concern as the manager. There's nothing more scary than a manager saying, than as an employee, your manager being like, hey, can I talk to you for a sec? Right? Like people get very anxious about that. So make sure it's coming from a place of caring and concern, letting them know that you value them, but you are worried because you've noticed these behaviors. They've started to come late. That's a change. They appear more disengaged, right? More distant. And you want to let them know about the resources. I promise you will not offend them by having this conversation with them. In fact, they will feel cared for. My supervisor or someone at work cares about me as a person. This will show them that you care about them as a person. Okay, I'm looking at the time. Okay, so building resilience every day. So if you know me at all or you came to my talk last year, I feel that it is really important that you can do something the minute you leave my presentation, right? I mean, I've gone to so many conferences where I sit through a presentation and I take lots of notes and I'm really excited, I'm really inspired, and I walk out the door and I never do anything about it, right? It happens all the time. So I really feel like I want to give you guys some action items and things that you can do right away. So this is something that you can start to think about immediately. And you can also talk to your team about, like during a team meeting, if you do wellness activities or things like that during team meetings. So the first thing is manage the source of information. How many of you have heard of the expression garbage in equals garbage out, right? Came from the computer world. The idea that you can't put in faulty data and get the right answer, it's not going to work. So I want you to think about, and this is just for you. If we had more time, I'd have you guys talk to each other and then talk to me, but we don't have time for that right now. But I want you to think about for yourself, where do you get your information? Like really take a minute, reflect on this information. And if you're distracted, if you're on your phone or whatever, just take a minute and think about it because this is really important. Where do you get your information? What do you watch? What do you listen to? What do you read? Who do you hang around? Okay, so take a minute, think about those things, think about your life, how you're getting these inputs. And then ask yourself the following questions. From where do I get most of my information? And are these inputs helping me stay positive, or are they making it more challenging for my well-being and for me to stay positive? What negative input sources would I benefit from limiting or eliminating, and what positive input sources should I increase my exposure to? I promise that when you eliminate negative input sources and replace them with positive input sources, it will change your mindset. It will change how you feel, right? So for example, if I'm driving my hour commute and I'm listening to the news or to politics, it doesn't really make me very happy. It doesn't make me feel so good when I get to work. So maybe I should turn that off and I should replace it with a podcast on the making of Bridgerton or something like that, right? Like TMI maybe, but a podcast that's going to make me happier. It's going to change my mindset when I get to work. I will feel differently. So I just want you to think about, where do you get your input information? And is it helpful? Or are there things that you kind of think maybe you should change, and what could you replace it with, okay? So building resilience, look for opportunities. In struggle, there's some opportunity to learn and grow as a person. I'm a licensed psychologist. I did therapy for years and years before I turned to doing consulting. And I will tell you, I mean, so many times when I did therapy with folks and they went through something really challenging and they would say, I couldn't believe I got through that. I didn't realize how strong I was, or I'm so much stronger now, right? Getting through that awful situation. There's some opportunity. In dealing with challenges, ask yourself, what is great about this problem? That's not easy to do. If you're in a terrible situation, asking what is great about this situation or this problem, that is a tough thing to do. But changing the question that you're asking yourself will change the answer. So, for example, I feel like everybody has already asked this question before, right, over the last 3 years, but what is one positive thing or opportunity that came from the pandemic? Something that wouldn't have happened otherwise. So I am going to give a chance for anybody if they want to share the answer to this question. So what's one positive thing that came from the pandemic? And I guess because they're recording, they are making you walk up to the microphone, which might limit people doing it. But what's one positive thing that came from the pandemic that would not have happened otherwise?
I'll speak really loud, and my absolute favorite is curbside pickup.
Curbside, she said curbside pickup. I'll repeat it for the recording. Curbside pickup. I agree. Like, we still get food delivered. We're so lazy. We still get food delivered. My husband will be like, I got Jimmy John's delivered. I'm like, it's 10 minutes down the road. We can't pick up Jimmy John's? Oh, they'll deliver it. Okay. Curbside pickup. Wonderful. Anybody else? Something positive that happened from this horrible, horrible event. Remote work, she said. Absolutely, right? And I think that there are some people, my manager notwithstanding, who realize that people can work really well remotely and maybe even be more efficient and get more things done. And I think that there are definitely managers out there who didn't really believe in remote work before or weren't really jazzed about it that feel very differently now, right? So opening our eyes, different perspective, which we'll talk about in a little bit. Anybody else?
Home infusion's in a better place.
Okay, talk more about that.
Well, I work at NHIA, but I mean, for years and years, we've been talking about how home infusion is, easy and cost-effective and safer. And until the pandemic came, utilization, I'm not saying it was bad, but we've seen utilization increase, and we've seen people take risks with drugs that didn't used to be considered safe in the home, and there was no other choice. So they took a chance, and it's proven to be pretty good.
Okay. So the profession, she was saying that home infusion has gotten to a better place. I don't want to mess up your words, but people are trying things they didn't try before. They wouldn't try before.
Out of necessity.
Out of necessity. Okay. Wonderful. Yes.
I agree with her. I spent 20 years in the sales force for the infusion industry, trying to convince physicians who kept telling me they need an IV, they have to be in the hospital. Well, then they were forced to give those patients that option.
Right.
And with the staffing shortages in hospitals now, it's giving them the ability to avoid nurses from having more patients than they should under their umbrella.
Mm-hmm.
And of course, we always have payer problems, but pandemic forced those doctors to make those decisions, and it took it out of their hands almost to the benefit of our industry. And we've shined
Mm-hmm.
in many ways. It gave us the opportunity to shine in healthcare across many sectors.
Mm-hmm. Okay. So it changed, it was a forced change of perspective almost from what I'm hearing you say. It forced that, people weren't going in the hospital, they couldn't go in the hospital. It had to change the way that they were doing things and change the way that doctors were requesting things.
And even bypassing the hospital,
Mm-hmm.
where they go straight from the physician's office to home, you get the pick done, and they never even checked in
Mm-hmm.
because they weren't that brittle. Even our chemo patients didn't want to go into the cancer centers,
Mm-hmm.
so we were able to do more chemo at home.
Sure.
Yeah, even drugs that they wouldn't do before,
Yeah,
Mm-hmm.
like Tisabri.
right.
Okay. So for the recording, talking about people using drugs that they wouldn't use before or bypassing the hospital and doing more treatment at home and having home infusion shine. I love that word. I love that. Okay. Yes.
Allowed us to become more innovative.
Mm.
And so we had to really be very flexible and creative about doing the things that we've always done, but in innovative ways and with more technology, with more resilience. So I think we all became more innovative.
I love that. She said it forced us to become more innovative, right? I love that. Absolutely. Yes.
The innovation of new hospital at home programs.
I had a hard time hearing that, sorry.
Hospital at home?
Hospital at home program. Okay. So really, it's so interesting. Of course, we're at a professional organization, but you're kind of thinking about the advances of your career field, right? And your field in terms of innovative, creative solutions, people realizing there are other ways to do things that might be more efficient, might be better, helping you all shine and try new things. I love that. I love that. So, anybody else have a burning desire to, okay. So thinking about these things, thank you so much for those of you that were brave and spoke up, but thinking about those things, this was a horrible situation, right? Nobody would say the pandemic was great, we're so glad it happened. I mean, no one's gonna say that, nor should you, but these things that came from it being creative, innovative, looking at things from a different perspective, becoming more efficient or better in a forced way because we had to, right? Maybe communicating with people we didn't normally communicate with. These are the lessons that I want you to think about coming from a tough situation or coming from challenges, right? John Adams said every problem is an opportunity in disguise. And we're talking again about how do you change the way that you think about things when you're in really tough situations. So resiliency strategies for healthcare leaders. So create a culture of wellness. What the heck is a culture of wellness? Well, the American Medical Association says it is a work environment with values, attitudes, and behaviors that promote self-care, personal and professional growth, and compassion for colleagues, patients, and self. I'm going to say that one more time. Culture of wellness. We need to be doing this at our organizations. We need to have work environments with values, attitudes, and behaviors that promote self-care, personal and professional growth, and compassion for colleagues, patients, and ourselves. If your organization is not focusing on how to create a culture of wellness, this is the direction you need to be going. We need to be retaining our employees. We need to be focusing on employee well-being right now, okay? So what are some things that we can do for that? Well, define professional wellness as a priority. Show your team that you care about well-being. So I'll give an example. There might be some people in this room from this organization, but I'm working with one particular organization, and I'm doing a self-care webinar series for them. They're showing their employees, we care about self-care, we care about well-being, we're having this regular webinar series. Oh, and we have all of these other things in place too that we talk about during the webinar series, right? We remind people about the resources that are available. Showing your team that you care about well-being, and that, in fact, it is a strategic priority for your organization. Use resources to regularly assess how are folks doing, whether that's an employee engagement survey, Gallup or otherwise. There are many platforms, for employee engagement. There are well-being surveys, there are burnout surveys. You need to know how folks are doing, and you need to know if what you're doing is helping, right? I mean, you could put things in place all day long, but if it's not moving the needle, then we need to be doing something else. So measuring, how are we doing? Create a toolkit of interventions. Make sure people know about the resources that are available to you. Do you have a health and wellness platform? Reminding people about the employee assistance program. Are you doing webinars? Are you bringing people in? What are you doing for your team, and are they aware of it? Develop a communication platform for employees to address the challenges, right? My opinion counts. We want to know how people are doing and what ideas people have, all right? So develop some sort of communication for that. And then incorporate well-being tips for leaders. So this is something that I'm doing for our organization once a month. We have an all-leadership phone call, all of our leaders across Johns Hopkins Community Physicians. I get on there for 15 minutes and I give a well-being tip for leaders, right? It's not anything, grandiose, but again, it's a reminder for our leaders, you matter, your well-being is critical to the success of this organization, and we care enough to bring somebody in once a month to talk about it. Okay? So well-being tips for leaders, however, whatever that looks like for you all. And then reconnecting with the joy of medicine. So we have a Joy of Medicine work group, we have a newsletter, webinars, whatever that looks like for you, you need to help yourself and people reconnect with the joy of medicine. Years ago, it was actually before COVID, I did this class on burnout for providers. It was for providers at our organization. And one of the results from that class was that a couple of the providers at that practice were like, we should start a book club, because we were kind of talking about like connecting in other ways, right, besides just walking through the halls of your practice. So a couple of the providers there started a book club after work, and then it expanded across our entire organization, and we actually have this book club across our organization. They meet like once every couple of months by Zoom, because we're really spread out all over the place geographically, and they have a book that people read, and they get together and they talk about it, and it's really fun. And one of the books that, I don't know why that looks like that on there. One of the books that they talked about is The Book of Joy, Lasting Happiness in a Changing World. Anybody heard this book before? One sole person. It's a great book, right? Have you read? It's amazing. Again, no royalties. but get it. It's amazing. So it's written by the Dalai Lama and Archbishop Desmond Tutu. There's a moderator, facilitator, and I'll give you a quick snippet for what they say in this book. So they talk about 8 pillars of joy and connected to resilience, 4 qualities of the mind and 4 qualities of the heart. They talk about perspective, that there's many different angles for seeing things. We talked this kind of goes along with what we just talked about with the pandemic, right? But they talk about if you widen your lens, it actually reduces fear, it reduces anxiety, helps you see things differently. And that if you, again, sort of changing that perspective changes reality. Your perspective is your reality, and you have control over that. So I'm keeping my eye on the time, but I have a really quick story about this because it's kind of profound for me, which shouldn't be, but it really was. So a friend of mine and her sister, their mom was in the hospital, and my friend gets along okay with her mom. Her sister does not get along with their mom. They're not really on speaking terms, but their mom was in the hospital. So they went to the hospital to visit her and, kind of visited briefly. And I was talking to my friend afterwards, and I said, so how did it go? And she said, it wasn't that bad. It went okay. It could have been much worse. Like, it was all cordial. We had conversations. It really went okay. But what was so astounding was when she talked to her sister about that situation, her sister was like, can you believe how horrible that was? Mom was so mean to me. Can you believe how she spoke with me? That was so awful. I am never going back to visit again. And my friend was just like, it was a completely different perspective, right? Same event, different perspective. And it just really made me think, and this is nothing profound, but it really just made me think about how your perspective is your reality. It doesn't matter what really happened in that room, right? My friend's reality was her reality, and her sister's reality was her sister's reality, and that's what happened in the room for them. Change your perspective. It will change your reality. You have control over that. Humility, they talk about how the word humility comes from the Latin word humus, which means earth, how humility actually literally brings us down to earth, right? Feet on the ground. And just remembering that we're all people just trying to be happy and live our lives. I think last year I might have mentioned assume positive intent, right? When you're talking with people, assume that we are all just trying our best. And if somebody screws up, it's not because they're out to get you. It's not because they're being manipulative. You don't really know what's going on, what happened to for that person in that day. We're all just trying our best. Assume positive intent with all of your interactions. It's not easy to do. It's something I'm working on myself, but it's really important. Humor, laughter, and they talk about sort of like self-humor, almost like denigration, but laughing at yourself when you mess up, and how humor is really, really important. We know that when you laugh, it releases endorphins, it decreases depression, anxiety. Acceptance. So accepting where we are in life, right? They talk about like turning your face to the storm and accepting that you're in that storm and it's okay. And then qualities of the heart, forgiveness, freeing ourselves from the past. Again, I mentioned that I used to do therapy before consulting, and we would talk about forgiveness a lot. And one thing that I would say, and they said this in the book as well, is that just because you forgive somebody for doing something doesn't mean that you're saying it was okay. It doesn't mean that you're condoning, and that's what stops a lot of people from forgiving. Well, I'm worried that if I forgive, then I'm sort of saying it was okay that they did that to me. They're two separate things. You can forgive without saying it's okay, and it actually takes some of that control back, right? That person doesn't really control your life anymore, and it's sort of freeing you from the past. Gratitude, I talked a lot about gratitude last year and how it relates to positive psychology. There's a whole field, positive psychology, lots of research on gratitude and how it helps physical health, how it helps mental health, keeping a gratitude journal, 3 things you're grateful for every day, a lot of different things you can do around gratitude and how it really helps. Compassion, something that we want to become, and again, this kind of goes along with assuming positive intent, right? Having that compassion and empathy for other people, trying to understand where other people are coming from, or realize that you don't know what other people, are experiencing, and that's okay, but realizing that you don't have the whole picture when you're interacting with somebody. And then generosity, and how, we tend to feel good when we help other people, right? It's positive for us when we are acting positively toward other people. So I just want you to think about, how do you embody these characteristics every day, both professionally and personally? Another quote, by our former dean at Johns Hopkins, it's hard to imagine a more critical issue for healthcare leaders than combating burnout and attrition, because our people truly are our most precious asset, the heart and soul of our institutions. Moreover, study after study shows that happier care providers are better care providers. So this is not just a human resource issue, it's about quality of care and doing what's best for our patients, right? When you're taking care of yourself, you can provide better patient care. That's what we want to be doing, right? So identify your resources to take care of yourself. Everyone knows I always end my presentations with these last two slides. One is identify your resources. Almost every organization has an employee assistance program. It's free counseling, confidential. If you're not aware of it, check into it. You probably have an organization development and training consultant, sort of my position. You probably have somebody like that at your organization who can do webinars or trainings or things like that for you all as leaders or for the organization. Coming to conferences like this, I imagine this is very joyful for people to connect and see each other and learn and develop professionally. So continuing to be involved with your organizations, get involved with mentoring programs, mental health professionals, lots of different things that you can do to take care of yourself and prevent burnout. A couple phone apps I always list. If you went to my talk last year, you heard these, but the Calm app that I use, Headspace is a meditation app, Delightful. Delightful is an app, and they're all free. Delightful is an app that, it'll prompt you every night. What are 3 good things that happened today, right? So I kind of like that. I don't always answer it, but I kind of like it, that it prompts me to think about that every night. And then, a lot of organizations have wellness programs at work and things like that. So I just want you to think about, we're not going to share this, but again, it's really important to me that you are taking something from today and you are turning it into action, and not just sitting here and enjoying the hour, but that you are actually taking it and thinking about what you will do with it. So think about or write down what's one thing you learned today that you can start doing immediately to reduce your stress, to increase your resiliency and engagement at work. Think about that, take a minute maybe to write that down, but then also think about how you maybe can extend that to your team. Is there something you can bring to a team meeting or remind folks about? It's important to write it down or share it, keep yourself accountable, but I really just want you guys to think about what is it that you can take with you. I know you have access to the slides. There's lots of references on here, so there is a reference slide. My information, I do have cards up here. If you have any questions from the presentation today, please do not hesitate to email me. Happy to answer any questions. If you want to talk with me further about how I can work with your organization, happy to do that too, but happy to answer any questions. But most importantly, I want to leave you with this last slide, which is this, because this slide makes me smile so much, it makes me so happy and fills me with joy that I hope that this is how you feel as you're going through the rest of the day and the rest of the conference. Thank you. Actually, maybe most importantly, here's your CE evaluation code. Are there any questions? We've got about 5 minutes for questions, and then I'll hang around. If there's another session in here, I can hang around out there if people have questions or comments. Questions about anything? Okay. Thank you.